A work field is prepared in which to perform the digital nerve block. The following instruments and materials are then assembled. An anesthetic agent, for example lidocaine or bupivacaine with or without epinephrine. Draw-up needle. Subcutaneous injection needle. And 5 to 10 milliliter syringe. If necessary, a Penrose drain and locking clamp can be used to create a tourniquet to provide hemostasis to the digit. Prior to aspirating the anesthetic solution, in order to prevent the syringe from forming a vacuum, a small volume of air is first aspirated and then injected into the vial. The anesthetic agent is then aspirated by retracting the plunger of the syringe. The draw-up needle is removed and disposed of using the sharps container. A subcutaneous injection needle is then connected to the syringe tip. Following non-sterile preparation, the procedure can be performed using both sterile and non-sterile techniques. In this film, a sterile technique is demonstrated. The patient's hand is positioned in pronation. The skin is disinfected at the planned injection site, slightly distal to the metacarpophalangeal joint of the digit that is to be anaesthetized. The needle is inserted at an angle perpendicular to the patient's skin. 0.5 to 1 milliliters of local anesthetic is then slowly infiltrated into the dorsal aspect of the web space, adjacent to the digit, slightly distal to the metacarpophalangeal joint, in order to anaesthetize the dorsal digital nerve. Note that the syringe is aspirated before injecting, watching the chamber for flashback of blood in order to avoid intravascular injection. The needle is slowly advanced towards the palmar surface, taking care not to pierce the skin of the palmar aspect of the web space. Another 0.5 to 1 milliliters is slowly injected to anaesthetize the palmar digital nerve. Anesthetic agent is injected slowly so as to minimize any pain to the patient caused by volume accumulation. The needle is removed from the skin and the process is then repeated at the contralateral web space in order to fully anaesthetize the digit. The aim of the digital nerve block is to infiltrate anesthetic around each of the digital nerves supplying a digit, thereby providing distal anesthesia. Here we see the distribution of the digital nerves and the appropriate infiltration of the anesthetic, firstly around the dorsal digital nerve and then the palmar digital nerve. The digit is then tested for sensation using a sharp instrument. The needle is then carefully removed from the syringe and disposed of using the sharps container. A clamped Penrose drain can be applied as a tourniquet if distal hemostasis of the digit is required. The drain is wrapped around the base of the digit and clasped using a locking clamp. The tourniquet can be tightened by rotating the clamp 360 degrees. The clamp is released to allow the return of normal circulation to the digit.